Hello, this is Lance Johns. I want to talk about Governor Sisolak on when he wants the state to open back up. As of last Tuesday, the schools will remain closed until the end of the school year, but they will do like online, learning, and they will have places where students can go and get food. If they don't have food at home, they can go get food. In certain places that they have talked about. The non-essential business will stay closed until they figure what to do. Like a decline in CV-19 cases, he said last Tuesday. He's I think I say this is phase one of it, but he said this is phase zero because he's saying that the cases have not. I guess they haven't like start going down and stuff. But he did a speech like March 15th. The order. Closure of non-essential businesses. I know he also was on the news like March 17th, like St. Patrick's Day night. Demanding that stuff closed because a lot of people wasn't listening to him. But he said the timeline for stuff opening it has to be based on health metrics, but he hasn't seen it yet. But he said we're doing everything we can to open up the economy as quickly as possible. But he said when he see improvements, it'd be phase one. But he had a speech for an hour last night on the state capitol. He said to reach phase one and lift business close to the state will. I guess it has to be a 14-day period in decline in cases and hospitalizations, as well as sufficient capacity in the healthcare system to conduct contact and traces of infected people with expanded cases of people with coronavirus CV-19 symptoms and more testing processed by labs. The state will demonstrate a sustained ability to protect our vulnerable populations, such as nursing care homes and assisted living facilities. He said, once these items have been completed, we can move into the first phase to reopen confidently, and we have our necessary protective measurements in place. He said, as of right now, he cannot give a date to when stuff will begin to be in phase one. But he just basically saying, no, if stuff don't improve, it's gonna take longer to start reopening stuff. And state health and medical officials who are advising the governor on the state's CV-19 responses joined him Tuesday. The hour briefly, including the state epidemiologist and a biostatistician who reviewed projections that show how social distancing directive have helped Nevada avoid worst case predictions like seen in New York and New Jersey. But as of Tuesday, 3,937 confirmed cases of CV-19 and 163 deaths. But Miles our province officials said Tuesday they still do not have enough data to see where the state is on a 14-day timeline. But they have started to see a plateau in the normal cases and stuff. But there's not sufficient data to see declining cases, said Kyle Morgan, a biostatistician, biostatist, a statist, a status. That word is hard to say. With the State Department of Health and Human Services, we're looking not only at declining new cases, we're also looking at hospitalization, looking at level of severity of those cases, what level of care they need once they're hospitalized. It's not a single metric. The governor office will announce where the state ends a 14-day period, but Sisolak added terms of determining where you're on a 14-day period. You don't know till you're part way into it and how it stands, and when you go back into it, you can come back out of it. Or rather, state planning for the first phase of lifting restrictions mirrors the federal guidelines. While the state moves towards that phase, since like I said, the governor's office of economic development would be reaching out and connecting with different business sectors and license boards on plans to open the private sector. The state will follow federal phase one guidelines that will prohibit in-person visits to senior living facilities and hospitals. The bars will remain closed per their guidelines. The medical advisory team will review guidelines on other business and activities such as elective surgeries, gyms, restaurants, movies, places of worship, and sporting events. We could flip the switch and turn the lights back on, but our experts predict and expert experience elsewhere in the world shows us if we do not do this in a controlled and informed manner, we will be hit like tidal wave in 2 weeks. The governor said the emergency is not yet over. But like, share, subscribe. Thanks for listening. Have a good night. Be safe. Wash your hands. Stay clean. Don't hoard. You know, help people, who need help. People that really need help, not people who want to get your money to go have a drink or smoke weed well, weed is legal in Nevada, so legal weed, not illegal weed. I mean, people who's gonna use the money for bad things, they don't need help in that way. But like food and stuff, yeah. I mean, I have food in my house I can give people. I have that, so if people want it. But okay, that's all I have to say. Thanks for listening. Goodbye. Have a good night. Be safe. Thank you.